Thanks for that, Sumit. I have the unenviable task of doing the last session of the evening, but the enviable task of speaking to the two stalwarts that we have with us today. Gentlemen, thank you very much. And it's very exciting to talk to the two of you. You've been trailblazers in your respective industries. I don't want to presume that the audience doesn't know the work that the two of you do as individuals or your organizations, but just to set the stage this evening, very briefly, if you could talk to us about what it is that is essentially your passion and your organizations, and what it is that's led you to really become an agent of change. To you first, sir.
In Akshaya Patra, we started about 19 years ago providing meals to children in government schools. You know, the government is spending crores of rupees on the uniform, textbooks, school, teacher's salary, all of that. If the child is hungry, the child will not have a learning experience. So basically, it's a very simple concept. You invest small amount of money and provide food to the children so that all the other expenditure the government is making becomes more productive. So with this simple thought, we started feeding 1,500 children here in Bangalore, covering about 5 schools. And our model is to set up a centralized kitchen, cook large quantity of food and transport them to the schools. And today we are feeding 17.7 lakh children all over the country. We are in 43 locations. We have 43 kitchen locations. We are in 12 states in the country. Our mission is that no child in India should be deprived of education because of hunger. That's the problem.
Dr. Shetty?
I believe that India will become India will become the first country. India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. And it's going to take not 50 years, 100 years to achieve. It will happen within the next 8 to 10 years. Why I am so optimistic it will happen is predominantly because two major things, major shifts are happening. One is government decision to launch National Medical Commission to liberate medical, nursing, paramedical education. That will dramatically change how the doctors are trained. Nurses and medical technicians are trained. The second major way which will transform the healthcare is digitizing healthcare. Because we believe once the healthcare is digitized, once the paper and pens are taken away from the hands of doctors, healthcare will become safer for the patients, it will become accessible, and it will become affordable.
Sure. So I want to use today's session as a masterclass of sorts for our audience. If you could talk about essentially why it is you do what you do. Why is it essential that you do what you do? India has very often been called as a lab for social innovation. If someone was to become an agent of change here in the country, from your own personal experiences, both of you gentlemen, if you could say, this is what perhaps you should be looking at. Shri Chanchalapathi, first.
Why we do this, why we are, what inspires us. You see, Akshaya Patra has taken me to many places in our country. What I have seen is, in our country there is a lot of talent. It is just that the children have to get the right encouragement for that talent to blossom. And we may have complex problems in our country, but we have good people, talented people who can solve the problems. That's the optimism that we have. So if children are well fed, good nutritious food, and they are well educated, and they can do wonders, as Indians are doing wonders all over the country. This is a great asset of our country, people. So, this thought that we can make our, actually we have problems in our country, definitely. And so, if we solve all these problems, we will have a wonderful country, and people can do that. We have talent. That confidence, that is what actually makes us go on with this program.
Where did your conviction come from, Dr. Shetty?
If a solution is not affordable, it is not a solution. It's pointless us talking about developments in healthcare if people can't afford it. But the beauty of all the changes what we have made is that today our group is about 15% of the heart surgery done in India is done by us. And we are doing these surgeries at fraction of what it costs in US and Europe. Like, for you to understand the numbers, all the hospitals in England put together under National Health Service, every year they do about 30,000 heart surgeries. Last year we did 17,000 heart surgeries at a price which is rounding off figure of what UK government spends. So essentially, we are going to show to the world that healthcare need not be expensive. Because we believe that today an Indian doctor, he is reduced to put a price tag on human life every time he interacts with the patient. That's very unfair. When there is a patient sitting in front of you, the discussion should be only about getting the patient better rather than how much he can afford to pay.
Which brings me to my next question, and that's the role of technology. And both of you speak very often about how technology has changed your industry. Dr. Shetty, perhaps even 7-8 years ago, no one would have spoken about healthcare and technology going hand in hand, but today it's become the norm. But where did your conviction come from? Because you started it at a point when there wasn't much being done in that space.
I believe that within the next 5 years, software will make smarter diagnosis than doctors. Within 10 years, it will become legally mandatory for the doctors to get the second opinion from the software before starting the treatment. I give this time frame as 5 years and 10 years. It's not really the case. It's going to happen much sooner. I give the time frame so that my professional colleagues won't shoot me down. But this is the reality. Yeah.
Speaking of technology, I also want to broad base that question for you, Shri Chanchalapathi, and talk about the role of innovation. And Akshaya Patra is Akshaya Patra because of the innovation that you've seen. You've built machines specifically for each of the food processes that you have. In the south, your machines, for instance, are very different from what you have in the north. And all of that is innovation that you've done in-house, in your kitchens. What has that journey been like for you?
You see, in our country, we are a very big country, large number of people. And if you want to make any impact, you must do it on big scale. For achieving scale, two important things is what we have learned. One is we have to work with the government, because government has large number of, has resources and is actually dealing with large problems. So if we work with the government, it gives us an opportunity. And the second important thing is to achieve scale is use of technology. So this is inevitable. It is part and parcel. We have to use appropriate technology, something that's appropriate to our country, our situation. Like you mentioned, we started in Bangalore, and it was simple rice, sambar, and curds, and some vegetables. That was the meal that we were giving. Then we were invited to Rajasthan. We went to Jaipur, and we had to provide their roti. And we started feeding about 10,000 children, and we had to give 2 rotis, 20,000 rotis to be made in about 3 hours' time, and it was a Herculean task. We had so many women rolling, and we had men, and then they would have their hands burned, and sometimes in the summer, and So we had to look for something. And then we found somebody who was making someone had a papad making machine. But papad is different, roti is different from papad. But then there were very innovative people. We worked with 3 different people who had these kind of thing, and we said that we will invest, you convert this into a roti making machine the way we wanted it. 2 of them failed, 1 succeeded, and he made a machine which could make 10,000 rotis per hour. And then in the next few years, we worked on it further and improved it. Today, we have machines which can make 40,000 hot, crisp, fulka rotis in an hour.
That definitely deserves applause. I've seen videos of this machine, and I think it's about 6 feet long, if I'm not mistaken.
It's about 30 feet long.
30, okay. I've got my numbers way off, but congratulations on that, and that's definitely an excellent example of how innovation is changing what you're doing. I want to talk about the role that funding has as far as doing good and giving back to society and societal good is concerned. Reports suggesting there's a $60 billion funding gap, even if all the funding which is coming into the ecosystem is going into those areas, the top 3, 4, 5 areas in India which are really critical right now, including education, including healthcare. How perhaps can that be fixed?
As I mentioned earlier, India is a very complex country. Problems are complex. And the government has good policies, government has funds also. But we can't leave the problem, solving the problem just to the government. There has to be civic society participation in this. Individuals, organizations, we all have to come together to solve these complex problems. Especially in our country, the paradox is we are a very rich country with a lot of poor people. So there is money in our country. And government has very good programs. Finally, the delivery of those programs and the last mile delivery, that's the challenge. So individuals, organizations, NGOs can all come together, work with the government. And part of that is also a certain amount of contribution. Like say for instance, our meal in Akshaya Patra costs about 14 rupees. We get support from the government. We work closely with the government. And we were able to scale, as I said, because of the government. We are an implementing partner of the government's program. So we get about 50% of the cost from the government. We have another 50%, and it is because of the support of people. And another thing, we don't have a corpus. We don't have an endowment. Our endowment is, our confidence is the goodness of people. That's our confidence. So we are really counting on the goodness of people of our country to contribute and make this happen.
Dr. Shetty, while I ask you to also respond on that, data also shows that 60% of all contributions which are coming in for philanthropic causes and for social good are coming from individuals. There's not much else that's being done. Do you think that's a good model to perhaps have, given how closely you work when it comes to giving back to society at your organization?
See, in the area of healthcare, I believe that we should have a sustainable business model which shouldn't be dependent on the charity. One-time charity to start some initiative is fine, but sustaining is a challenge. See, 15 years ago, we came up with the concept of Yashaswini Micro Health Insurance, where we thought if every farmer paid 5 rupees per month, one day he decides not to smoke, and he saves 5 rupees and pays for the health insurance. That should pay for the cost of any surgery if he requires, including heart operation. And people laughed at us, but the government of Karnataka had the maturity to accept the scheme, and they launched it. First year, we had 1.7 million farmers paying 5 rupees per month. Subsequently, we had 4 million farmers paying 5 rupees per month. At the end of 12 or 13 years, 1.5 million farmers had varieties of surgeries in one of the 400 network hospitals, and 1.5 lakh farmers had a heart operation just by paying 5 rupees per month. if we can collect, so if we can collect 20 rupees from each mobile phone subscriber every month, people spend 150, 200 rupees just to speak on the phone. If you collect 20 rupees from every person who is using a mobile phone, we can cover the catastrophic illnesses of every citizen of this country. It is possible.
You're talking about sustainable business models. Very briefly, if I can take just a couple of more minutes on the clock and ask you to talk to our audience about the fact that along with doing business, it is possible to give back to society and it is possible to do good, and you are really the answer to that. But what has been the learning along the way for you? How do you do that? What sort of advice would you want to give someone who says, I'm running a business, for instance, but I do also want to give back to society?
See, the first thing is when any young entrepreneur wants to start something, he has to ask a very important question. Normally, two questions they ask themselves and answer. That is, what do we do and how we do. But very few of them ask why we do. So that is the first question. And if that why, what they have in their mind, if it is going to touch the lives of millions of people, believe me, cosmic forces connive their way to make it happen. It is hard, but they will succeed. So any business model young people want to come up with, it has to make a difference to people, especially working class and poor people. It is hard, but they will succeed. But if they concentrate on a product or a service for the rich people, soon they will realize that the rich people can run faster than them. So I wouldn't put my money in those products. Yeah.
Sure. Shri Chanchalapathi, this question to you, and probably Dr. Shetty can answer this as well. And that's the question of people joining organizations like yours. A lot of times, organizations tell us that we're unable to hire the best and the brightest in the industry, and these are the ones who probably coming in with the passion, etc., that's required when you're doing the kind of work that you're doing. What has your experience been? What sort of insights can you give our audience tonight?
Actually, we have had quite a contrary experience. Especially the young people in our country, they are very willing to participate and they feel for the issues of our country and they are coming forward. Of course, we also have in Akshaya Patra a volunteering platform, and we have a lot of young people offering to volunteer. And even we were invited by IIM Bangalore and a few IIM Ahmedabad, and we picked up a few people from those kind of institutions also. So it is not that talent is not willing to work for social causes. There are talented people, and I think there is a lot of people, young people with a lot of good heart wanting to do good things in our country. So we have to make certain things more interesting, more attractive for them.
Like what?
I think a good organization with good ethics, good practices, good governance, all of those kind of things draws people. Young people want an ethical organization, very compassionate organization, good governance, transparency. And if we provide these features, I don't know, it has been our experience in Akshaya Patra, we have been able to attract good people for about, maybe about 60% of the salary that they would get if they work for a for-profit organization.
Which is a similar concern, I would assume, that one is seeing in the Indian healthcare space, Dr. Shetty. Doctors perhaps who are working in India, earning a fraction of what they would be making if they were working outside of India. How do you then address that problem?
You see, the outstanding doctors across the world with magic in their finger, they're invariably eccentrics. If they didn't have the degree of eccentricity, they can never reach that level. So they like to work with another group of eccentric people, and I'm the most eccentric one among them. So we have a very good working relationship. So that's very important in terms of how challenging is your place to work. Yeah, we have no rules, regulations for the doctors. They have the total freedom as long as they take care of the patient's safety and the need. Now, but interestingly, around 5 years ago, we started a software division because we believe that digitizing the healthcare will be the way forward and that will dramatically transform healthcare. So we were told that software engineers are the most difficult people, they don't stick around. But we thought, we tried with various big companies, small companies, international companies. Very difficult to work because our requirements are different. So we started a software company assuming that people may not stay. But you'll be surprised and shocked to know, we virtually have 0% attrition in the last 5 years. Now, you'll be wondering why. Again, it's a power of purpose. We made it very clear that 95% of the world's population has no EMR, electronic medical records. We want to create a EMR which is available to every hospital on the planet, and the price tag, we don't want to sell it. They will use it per patient per day. When they use the EMR, they have to pay us the price of one disposable plastic syringe. That is the value. Now, why we want to give the software for the price of one disposable plastic syringe? Because in healthcare, when we do the costing of any product or a service, we never cost the price of disposable plastic syringe. It's so small. So this is the way this software should reach out to them. People, doctors, hospitals should have no excuse for not using the EMR. And that is the reason why we want to do this. And that is the main reason why people feel that is the way it can make a difference to the whole world.
Two last questions as we end tonight's discussion. And the first is that, do you think that in a country where most people perhaps are shying away from talking about the good work that they're doing, we need more people like yourself who are, public figures encouraging other people to do it? Do you see that happening?
Yes, it is needed. More visibility of good things that are happening is very much essential. A lot of good things are happening in our country, and we need to highlight that, and media should play an important role in that. And as Doctor was saying, when you talk about the impact, the young people want to see, whatever they do, they want to see what is the impact on the society, on the environment, on the planet. So these things, if these things are highlighted, given more visibility, I'm sure we can attract more talent, we can attract more resources, and all of this will help to solve complex problems of our country.
See how many people we can touch in our life. But if we can set an example, it's a precedence. If one person, the Tenzing and Hillary, before they climbed Mount Everest, thousands of people tried, but nobody could reach. But after they reached, within a year, huge number of people reached. How did they reach? What has
Too many people, in fact, going now.
Yeah, it happened because somebody else has done it. If somebody else has done it, even I can do it. So essentially, people who have made a difference, they should talk about it and explain to others so that a lot more people will follow the path.
All right, let's end this with getting one piece of advice possibly that the two of you would want to leave our audience with here tonight. One piece of advice that's maybe changed the way you look at things, that has changed you personally. Let me come to you first, Shri Chanchalapathi.
We are dealing with children, and children in government schools where the circumstances are not all that encouraging like a child going to a private school would have in our country. So children have dreams, and if we can somehow find a way that these dreams are translated to reality and create an opportunity, there are wonders that we can do. We have come across children The mother is a flower vendor sitting outside in a market. He had a desire to become an astrophysicist. So we connected him to the Indian Institute of Astrophysics, and he interacted. He went and saw a telescope, and his whole perspective changed. We had another boy, father was a bus driver. He wanted to become a chef, and we tied up with Taj, and he got trained, and then during the summer vacations, and the first time he was coming to a star hotel, and these are the kind of things, if we allow children with dreams, and if we can facilitate that, the society, the people, industry, the government, and connect all of these things, we have great dreamers, who can become great achievers, and that's, all of us have a role to play. In fact, we say, feeding a child is not charity, it's all our responsibility.
I have a very different message to give all of you. It's nothing to do with my profession. I have a request. The request is, I would like you to quit the keyboard if you want to change the world. I haven't been using the keyboard in my phone for the last 1 year. I use it once in a while. Every function I want in a mobile phone, I can do it just by speaking to the phone. If everyone quits the keyboard, starts speaking to the phone, either by saying hi Google or a hi Siri or whatever, believe me, the way mobile phone is configured and built will change. Once that happens, half the world's population today who have no idea how to get into internet and understand this beautiful world, they will be able to get it. Everyone, all the young people, all the people who are educated, we take our knowledge of, skill of using the keyboard for granted. Half the world's population who are especially past the age of 50, 60, they don't have the dexterity to use the phone, the keyboard. It's very complex. Why do you need a keyboard? That is the biggest deterrent for getting into the beautiful world of knowledge, which is freely available. And that should happen, that will happen if all of us decide not to use the keyboard. Then it will become very, very friendly.
Absolutely fascinating, gentlemen. Thank you very much for joining us here on stage. Thanks for your time.